Hello, I'm Dr. Amit Shetty. Welcome to the Future Health Podcast. This is the podcast about the way we work, the work we do, and how technology will influence the future of work in New South Wales Health and the healthcare industry as a whole.
We can do a test in New South Wales within, the fastest we can do is about 4 days turnaround. We can do a whole genome, sequencing all the genes, and some of these tests are even Medicare rebatable now. So there's been a revolution in terms of the technology, the time to get a diagnosis, and our ability to diagnose patients.
If you keep searching for something on Google, you're going to continually be fed what you've been searching for. It's going to feed your own bias.
This is the idea of screening people, offering them a genetic test before they have a baby in order to test whether both parents are carriers for the same very rare recessive genetic condition.
So clinicians have gone from being very patient-facing to being very computer-facing. They're talking to a patient, they're sort of observing the patient, but they're spending a lot of time entering data into digital systems. And that isn't necessarily the best use of their time. They go to medical school for a very long period of time and go through extensive training to work with patients, to treat patients, not to be data entry robots.
Good morning and welcome to Day 3 of the New South Wales Health Workforce Forum 2020. For those of you who've joined us for either Day 1 or Day 2 or both, it's good to be with you again. For those of you who are joining us for the first time today, good morning, and my name is Claire Harris. I'm your MC for the day today. The Forum is an annual event run by the Ministry of Health's Workforce Planning and Development branch, and it's in its 5th year this year. The aim of the forum is to share and promote best practice and to build networks. I would first like to begin by acknowledging the traditional owners of the land. And we'll be watching a special acknowledgement to country video provided by our very own New South Wales Health staff this morning. So let's see who's welcoming us today.
Greetings from the lands of the Wiradjuri people. I acknowledge the traditional custodians of the various lands on which we work today and the Aboriginal and Torres Strait Islander people participating in this event. I pay my respects to elders past, present and emerging and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales.
Hi everyone and welcome from Northern Sydney Local Health District. We'd like to acknowledge the traditional custodians across the Northern Sydney region, the Gamaraygal, Guringai and Darug peoples.
We would like to pay our respects for their elders past, present and emerging and to all Aboriginal and Torres Strait Islander peoples present.
As we gather to share our collective knowledge and learning, we recognise that Aboriginal and Torres Strait Islander knowledge and learning is over 60,000 years old and forever embedded in our culture of all Australians. This is,
was, and always will be Aboriginal land.
Thank you so much to the team at Northern Sydney Local Health District and Hetty for their contribution this morning. That was great. As you've probably already guessed by now, this year's forum is a virtual event and we're currently filming and live streaming from One Reserve Road. This event is being recorded, so please ensure your contributions are both respectful and appropriate during the audience participation and in line with the New South Wales Health Code of Conduct. And please note, individual recording of this session is not permitted. We'll be using Slido to take questions and feedback from you this morning. So please feel free to go to www.slido.com and use the event code #WorkforceForum2020. We did have a poll running before the forum this morning, so let's have a look at the results now. So our question to you this morning was, in a word, what have you learnt at the Workforce Forum and what will you implement in your workplace? And overwhelmingly you can see that the results are collaboration, resilience and teamwork. Thanks for those of you who contributed to that this morning. So last week we had the pleasure of hearing from Dr. Richard Harry Harris. He spoke to us recounting his experience of the Thai Cave Rescue Mission in 2018. We also heard from some of our staff on the theme of adapting to change in the New South Wales Health Heroes session. So please join me now in taking a look at some of the highlights from day 2.
One never quite knows what life has in store for you, what's around the corner. And I think that every challenge, every experience, every hurdle can be viewed as an obstacle, but it can also be viewed as an opportunity to prepare for what's coming next.
What we want to create is a culture of grassroots innovation. So our aim is really to look at how we can enable our leaders to start to build that culture so that they're building innovation into everything they do every day.
What we're really hoping to see is that these leaders go back into their workspaces and actually encourage that growth mindset. You know, it's safe to fail, it's safe to give things a go.
A security guard at a quarantine hotel tested positive to COVID-19. We were able to open up a walk-in and drive-through pop-up clinic at the Maritime Museum the next morning at 8 a.m. Over 700 people were tested and 50 different staff members were utilised over the 3-day clinic.
The plan would be that I would go through to Chamber 9 with 4 of the British divers, and one by one I would anaesthetise the child and get them prepared in their full face mask and scuba tank. We thought the anaesthetic, each dose of ketamine, would probably only last about 3/4 of an hour, and yet these boys had a 3-hour journey ahead of them, which meant the British divers in particular, they would have to top up the anaesthetic and quickly learn how to look after their airways underwater without any vision.
Our focus was very much about designing high-impact training that would enable our learners to really fully grasp what the role required of them. What we wanted to do was design a series of really interactive, engaging learning activities that would help learners to practice and really try on the role with their colleagues in a safe training space.
I'm sure I speak for many of us when I say that I was both moved and amazed at the sheer complexity and scale of the rescue mission that they undertook and how everyone came together to save those boys and their coach. Harry's experience was an exemplary tale of someone adapting to change and being tested to use his expertise and knowledge in an unfamiliar situation and working with limits. For those of you who missed it, I would encourage you to go and have a look at the forum in full. And an email was sent earlier to your registered email with a link to day 2 of the forum. All right, we're going to move on now. I'd like to encourage those of you who have been invited to participate in Breakout Stream A, the Insight X session, to please click on your Zoom link that you received via email. And those who are joining us for Breakout Stream B, New South Wales Health Heroes, stay right where you are. So I'd like to now introduce our presenter number 1, Christine Tate-Lees from Northern Sydney Local Health District. Christine's going to present this morning on COVID care, people and culture supporting Northern Sydney Local Health District. Christine is the manager of the Organisational Development and Talent team in Northern Sydney LHD and believes that she has the best role in the organisation. She fosters leadership capability across all layers of the district and works with teams and individuals to build a positive, engaged workplace culture. There are some tough negotiations and complex change leadership pieces within this role, but overall she solves problems collaboratively and constructively to enhance employee experience and organisational performance. Thanks, Christine.
Thank you, Claire. So, I'd like you to cast your minds back to early March 2020. We were recovering from the bushfires and Northern Sydney Local Health District, along with the rest of New South Wales, was taking a deep breath of fresh air when COVID-19 hit our district. So to put this into perspective, obviously we'd heard stories about COVID-19 from around the world. We'd already had some cases in Australia from overseas acquired, but this was our first community transmission and it came to Ryde Hospital. We hadn't yet had the pandemic announced on the 11th of March, nor had the borders been closed. So it felt quite sudden that we were now dealing with COVID-19 in Northern Sydney. It was here, and people and culture needed to flex and respond quickly. So we put together a range of initiatives to ensure a safe and healthy environment during the pandemic, and the COVID care teams was one such initiative. So it was born from a request from our Chief Executive, Deb Wilcox, who wanted to know what was happening out in the district. What did people need? What did they want us to do? How could we get information to them? And what we thought we needed was a bold strategy that enabled us to be shoulder to shoulder with the frontline staff. Our vision was to be visible, connect with our staff, and communicate to and from the frontline in real time. No biggie. So an all-staff communication went out to all staff in Northern Sydney, and of course our newsletter as well announced that we would be rounding and that we would be recognisable in our pink vests. So we pulled a team together, we briefed them, provided up-to-date information. It was on things like the difference between close contacts and casual contacts, what PPE people might need, how the virus was transmitted, and then we donned our repurposed EMR project vests and headed off into the district. The COVID care team was contributed within existing resources. We had 27 people that moved in and out of the team. We were supported by our counter-disaster teams and the carer support teams as well. We managed to get out to every nook and cranny of the district. And initially we had multiple visits as information just kept changing. So a typical COVID care round involved 2 people in our team. So they might have been from Work Health and Safety and HR or OD and the education team. We would then check in with the manager, have a conversation with them, check in on them, and then have a COVID safe chat with the staff. We provide them with information and respond to their questions. We also delivered a lot of donations that we'd received as a district, so we often came bearing gifts of chocolate, which I'm sure helped our popularity and our profile soar as well. Typically questions included things like, what do I do with my uniform when I get home from work? How many COVID patients are there in the hospital? What type of leave can I take if I have to go into isolation? Why can't I wear a mask? So, and the question that just kept coming was, where can I get some toilet paper? Hashtag toiletpapergate. So we'd visit anywhere from 5 to 10 teams on a shift, and that would be anywhere from a half day to a full day session. We logged issues that we couldn't immediately respond to, and we always followed up. That was the key. We built trust with the organisation through our responsiveness. Keeping up with changes initially was an extreme sport, but gradually we started to get some structure and processes in the team. So we had a daily email, for example, which had responses to frequently asked questions, any key policy changes that had come out, and of course the schedule for the next day. We also introduced some debriefing sessions to take care of our carers. It could be quite challenging. There was a lot of anxiety in the organisation. And we had a daily escalation meeting with our director, Paula Williscroft, or other executives, to let them know what was happening around the district. We also introduced some staff pulse surveys, which happened in April and June, and we received a lot of information from people through that process, and we fed that back in a you said, we did fashion. We had constant support from the Chief Executive, who was communicating issues that were raised, and there was always a direct link between the concerns that people were raising and the actions of the district. You said we did. We stopped the COVID care rounding in mid-May due to the drop in demand. At that point, we had done 37 days across 6 different sites. We then introduced some pop-up information centres for a couple of weeks, but these 2 were decommissioned as case numbers decreased in New South Wales. The pop-up centres was an opportunity for staff to come to us rather than us rounding in the teams. So a second round of rounding occurred in July when the Amber Alert came out through New South Wales Health. We were actually able to stand up the team just in one day, so we had our processes well entrenched by then. COVID care went digital from early April. So we had 2 different things that we did in the digital space. We had set up weekly webinars from the 15th of April. And the Wednesday webinars have run every week since, with a wellbeing focus and an opportunity for staff to respond to, to participate in Q&As, so with our infection control team and so forth. The COVID Care Hub, which was our intranet presence, evolved in alignment with the phases of the pandemic. We had 3 key areas that we worked with: health and wellbeing. So we had pieces on mental and physical wellness for our staff. We had the leadership and team area, which was supporting those changes in the teams as they progressed through the pandemic and people worked from home or disparately. And we also had some work from home strategies where we were supporting flexible work practices. Our Be Like Rita campaign started in June 2020, and we noticed that there had been some general complacency. So Rita's purpose was to remind staff to be COVID smart. Rita hit it big on Facebook with over 10,000 likes. She's one of our CNCs for infection control within the district. And we can see her absolutely everywhere throughout the district now, subtly supporting the key messages of social distancing, hand washing, limiting physical contact, and taking care of yourself and others. Rita is COVID smart. Be like Rita. Overall, our COVID care response helped alleviate anticipatory anxiety experienced by our staff. And our instinctive approach met the key principle of the British Psychological Society guidelines for responding well in the active phase of COVID-19. Visible leadership, regular communication, consistent access to physical safety needs and human connection. It aligned with the health workers' favour for synchronous face-to-face communication and enabled quick transmission of information between busy clinicians and non-clinicians and our busy management. Always things can be done differently, perhaps better in hindsight, but we really didn't have the time in this instance to plan the perfect solution. It was innovative, but somewhat ad hoc and chaotic at times. What we tried to do was use skills differently, upskill our people where we needed to, provide the support the business needed, and also provide a positive experience at a time where employee wellbeing was paramount. COVID care evolved and matured throughout its deployment, with improvements in areas such as internal communication within the team, processes for escalation to stakeholders, and team cohesiveness and identity. Overall, I think COVID care was a successful strategy for Northern Sydney Local Health District because it had executive support, open lines of communication, agile leadership, and an effective brand. Fortunately, we've hung up our vests for the time being, but like my fellow COVID care team colleagues, I will be ready. And to misquote Holly Goldberg Sloan, I'm not sure for what exactly, but maybe that's what being ready really means.
Fantastic. Thank you, Christine. I've just got a question here I'd like to ask you, if I may.
Sure.
What's the biggest piece of positive feedback you've had for this initiative, and what surprised you most?
We got lots of little pieces of positive feedback. So we always were met with a great big smile. Everyone was like, oh, there's the people in the pink vests. So I think the fact that we were wanted and helpful was what really kept us going.
Great. Thank you so much for your presentation this morning. It was really interesting. That's great. Thank you. I'd now like to introduce our second presenter for the breakout session, Samantha Cairns from Northern Sydney Local Health District. Samantha is going to present on COVID-19, the staff welfare team. She's worked at Northern Sydney Local Health District for over 8 years in a variety of clinical and education roles. And when not working as the team leader of the COVID-19 staff welfare team, Samantha works as an education consultant with the Centre for Education and Talent Development at Northern Sydney Local Health District. The main focus of this role is managing the graduate health management program for the district. Thank you.
Thank you, Claire, for the introduction. So today I'm here to share with you my experience of the Northern Sydney Local Health District COVID staff welfare team. So imagine this, it's early March 2020 and COVID stories from around the world are jamming our news feeds and our screens. And you're a healthcare worker and your hospital is at the centre of Australia's first COVID-19 cluster. And you've just been informed that you are a close contact of a COVID positive patient. You were told to go home and self-isolate for the next 14 days. You live with your elderly parent in a 1-bedroom, 1-unit apartment, and you'd plan to do your weekly grocery shop tomorrow. Let's move forward now to August 2020. You work in an emergency department and COVID numbers, as Chris sort of mentioned before, were looking quite stable. Living with COVID is simply what we do now. Although hotspots are cropping up, it seems really unlikely that you would come into contact unknowingly with COVID in your workplace. It's the weekend and you've just received a call informing you that in fact one of your co-workers has tested positive to COVID-19. Contact tracing has identified you, along with over 70 of your co-workers, as close contacts. You must now self-isolate for 14 days. This will be the second time you've had to isolate as you returned from overseas after attending a funeral a month ago and isolated then for 14 days in a hotel. Or perhaps in fact you're the nurse manager of this emergency department. 30 of your nursing staff are amongst those 72 staff that are at home now isolating. You're facing the challenge of having staff for your department with not many resources available, plus at the same time you are acutely aware of the well-being of those staff members who are now at home. COVID-19, as Chris alluded to, hit Northern Sydney Local Health District swiftly and substantially. At this time it was extremely challenging for our individual facilities to provide consistent and structured support for those staff that are at home. We're doing well on the front line, as Chris explained, but we had staff at home who needed us. And again, remembering this was an evolving situation. There was constant updates, changes and challenges, not to mention that no one really understood what self-isolation meant, what you were and weren't allowed to do. PPE stocks were rumoured to be running low. People were fighting over toilet paper in supermarkets, and in fact, panic buying in general was our new norm. People in our families, our workplaces, our communities and across the country were concerned, frightened and scared. It was at this point the district realised that we really needed to ensure that those staff that were self-isolating at home after contact at work were being looked after in their wellbeing and welfare. The Northern Sydney Local Health District COVID-19 Staff Welfare Team, as we were to be called, was then established as part of the People and Cultures initiatives with the COVID care. The priority for the team would be to assist our facilities by providing welfare checks on staff who were required to self-isolate after being identified as a close contact with someone in the workplace, with the intention of helping them feel informed, supported, valued and not forgotten during the pandemic. The team, 3 education consultants from the education team, all with nursing backgrounds, were then immediately deployed to set up and start this new service. Together we worked on establishing a mini call centre with office space, phone lines, emails and capability to work remotely or independently if required to. A database portal was developed by our workforce systems team, and this enabled us to seamlessly manage these staff members through their self-isolation journey. This has been an essential aspect of ensuring efficient workflow and communication amongst our team members and ensuring that no staff who was at home isolating was forgotten. So what did caring for this staff look like? The welfare and wellbeing support is provided to each staff member through regular scheduled phone calls. At this initial call, we explain to them the role of our team. We run through a series of questions, ensuring that they understand what self-isolation means, what the signs and symptoms of COVID are to look out for, and what to do and how to get retested should that happen. We also at this point make sure that they do have access to food, supplies and support, and this was particularly important for those staff that lived alone. We also acknowledge at this time the potential impact self-isolation may have on their mental health and wellbeing. We go through options of how to access the in-house EAP services and also provide them with resources such as Lifeline and Beyond Blue. It's been our experience that during these calls, many staff will share their individual stories and experiences on the impact of isolation. And for example, a lot of them talked about how they didn't like feeling a burden to their family and friends. In hearing these stories, we've been able to assist where possible with individual issues as they arise, such as providing access to grocery deliveries, which if you remember back in the early days of COVID, that was really difficult. We've also assisted solo parents with additional activities and toys because they weren't able to leave the home to get extra things for their kids and they were all at home isolating together. After the initial call, we send a follow-up email and then organise subsequent welfare calls. These calls occur usually every 2 to 3 days, but are tailored to meet the needs of the staff member. Again, in these calls, we run through general questions, ensuring that they are remaining well and symptom-free. It is during these calls that more stories are told. This part in particular has been so fulfilling for all of our team members, building relationships with staff and hearing their stories and witnessing their resilience. Some of the challenges along the way, of course, as Chris alluded to, is because the pandemic has had a sporadic impact on the district, we haven't been needed all the time. So trying to work in our own normal work schedules around being needed with the team with only a short lead time has been challenging, but we are now expanding the team to have more resources to call along. And of course, the other challenge we faced was that of looking after us. We were conscious from the beginning that we wanted to provide an authentic and genuine service and not just tick a box. As such, the experience of supporting staff in isolation has proven to be intense for all of our team members. Early on, we engaged our EAP consultant, who encouraged us to have weekly check-ins with her where we could debrief the experiences. We had success along the way. We've looked after 125 staff, made over 400 phone calls, assisted in organising the retesting of 72 staff, and have answered many, many questions along the way. At the end of the day, I'm proud to say that I work for Northern Sydney Local Health District, a district who right from the beginning prioritised looking after its staff. I feel privileged that I've had the opportunity to be part of the COVID-19 staff welfare team. We are providing a service that is supporting our staff through these unprecedented times. And to quote one of the recipients of this support, "I feel extremely supported through this stressful and confusing time. I always felt that there was someone I could call on if I required. Without this team, I would have felt abandoned."
Thank you so much. Samantha, some questions have come through for you, so if I could ask. How important was the workforce plan in dealing with this situation? Have you got any thoughts on what worked best?
In terms of how we staffed the...
Did you reflect on the plan that existed, so pandemic plans or workforce plans that existed, and were they helpful to you in terms of how you rolled this out?
I guess they were. I mean, we responded when we needed to in terms of we were given a list of staff who were at home isolating, and that's where we moved from in terms of that support, I guess.
I suppose it was an ever-evolving...
That's right, and the first episode where we had a number of staff through the initial ride in Hornsby, it was a very... Things were changing all the time, thinking on our feet all the time, whereas when Hornsby happened a couple of months ago, we were much more prepared. In fact, the whole state seemed a lot more prepared. There was a lot more processes involved at that time too.
Did you find, in terms of system support, were there any stumbling blocks that, you went to rely upon something and you weren't able to depend upon that and therefore had to build it, or were the systems in place supportive at every point?
No, I think a lot of the things, I know when we first started to make those calls, we weren't really sure what we would get. We didn't
Yeah.
know what the response would be, what staff would need. So things like all of a sudden you realise that, no, well, you can't just leave your one bedroom unit and go and get groceries for your mother who can't leave and get the groceries. So how does that work when no one can log on and get groceries in a pandemic because they've stopped doing that? And it was those kind of things that we were constantly problem solving day to day, because no one had planned for how staff were going to get groceries should there be a pandemic and they were at home. I guess that was it. It was everything wasn't challenging, but there were lots of things along the way that we just worked out as we went.
And I guess, it was a stretch beyond health realm, in that you were having to think of things that were essential services for the patients or for the staff that you were caring for, but they weren't normally part of our regular remit. So.
And I think the other thing we had to be mindful of was that the staff we were looking after weren't all clinicians. So, explaining to them what signs and symptoms of COVID were was really important, because they weren't all nurses and doctors. There were cleaners and all support staff across the board. So we had to be really mindful that we were pitching a service that was accessible, I guess, to everyone.
Yeah, fantastic. Congratulations, it's a wonderful piece of work, and it's great to see that Northern kept staff so well and so safely cared for. Thank you very much.
Thank you.
Okay. I'd now like to move on to present our third presenter this morning, Belinda Meehan from Hunter New England LHD. Belinda's going to present to us this morning on caring for healthcare workers during the COVID-19 pandemic. I'd like to tell you a little bit about Belinda. She started her nursing career in 1991 at Blacktown Hospital, working for what was then the Western Sydney Area Health Service. Belinda then returned to the Hunter in 95 and started her registered nursing degree at University of Newcastle. Postgraduately, she worked for mental health for a number of years and then moved into staff health nursing. She's another one of our nursing underachievers. She has 2 master's degrees, a master's in advanced practice nursing and a master's of workplace injury management and occupational rehabilitation. And staff health, although not a high-profile specialty field of nursing, it doesn't currently have a specific postgraduate course that she would like to have done, obviously, but she nonetheless feels honoured to be a staff health nurse and enjoys the daily challenges that this role brings. She's especially proud of the relationship she has built with her staff, which allows them to feel safe, particularly at this complex time. So I'll hand over to you, Belinda.
Thank you, Claire. That was lovely, you reading that biography there of my work history. I appreciate you doing that. Just before I get started, I'd like to say on behalf of Hunter New England Mental Health Services, I acknowledge the traditional custodians of the nations within the Hunter New England region and pay my respects to the elders past, present and emerging. I acknowledge the significant place that Aboriginal and Torres Strait Islander people hold in Australia as the first peoples of this nation. I ask all those who walk, work and live on traditional Aboriginal lands to be respectful of culture and traditions. So whilst Claire gave you an overview of how I've developed as a clinician, I'd just like to tell you a little bit about mental health services before I go on. So Hunter New England Mental Health Services is divided up into 5 sectors that cover around 130,000 square kilometres. So we reach everywhere pretty much from Morisset to Tenterfield, out to Moree, over to Morisset, over to Taree and back again. And there's only me, just one FTE, that look after approximately 1,700 staff across this service. With the exception of this year, I do travel around and see as many staff as I can. Okay. In March, I could see that what was potentially going to happen in Australia with the pandemic developing across the world, I made the decision to put a safety plan in place for my staff and developed a model of care that you can see on the screen. The model incorporates 3 interlocking activities that have been designed to minimise the likelihood of a community-acquired respiratory illness, including the COVID-19 virus, being introduced into our workplaces. The aim of each of the activity was to keep staff well. I implemented the model in March and made adjustments as we learn more about the virus. These practices continue today and up until when the pandemic is declared over. Now I'll talk about each of these activities in the following slides. Promotion of health awareness has always been a core activity of the Staff Health and Wellbeing Service. In the early days of the pandemic, the focus of information was based around keeping members of the public safe by implementing infection prevention measures to minimise the viral spread. There was not a great deal of information around health and wellbeing for our workforce. The health awareness topics that we promoted or chose to promote in our service often was in response to repeated inquiries about the same topic, either COVID related, of a general or mental health concern, or if my team members identified an increase in the same type of symptoms being incorporated. The posters that were developed that you can see on the screen there are just some samples that were developed by a couple of my team members, Ashley and Liz. The more computer savvy members they were. There was a directive from New South Wales Health for influenza vaccinations to be given in a surge capacity. This meant sending out an expression of interest for nurse immunisers, developing a vaccination multiple site schedule, nurse immuniser rosters and ordering resources, developing supporting information for the nurse immunisers. In the past 16 years or 17 years, I've had the company of another nurse immuniser for 2 weeks only. And during these 2 weeks, we would work together for the first week, providing vaccinations here in the Hunter. And then in the second week, I would go up to the rural areas and do flu vaccinations there while my other team member continued to work down here. This year was different, however. The team member and I gave very few flu vaccines this year because our focus was on staff illness management. As you can see on the slide, I had a good-sized team and achieved so much in the 16 days. Very few of the team members knew each other. Some were not from mental health services at all. Some were not aware of the number of mental health services that we had here in the Hunter and other locations, or aware of the locations. For those staff that were in the rural areas, they linked in with the local staff health nurses. Fortunately, they also had a surge in nurse immunisers and were able to provide the staff in mental health with their flu vaccines. For my staff team that I had down here, not all the immunisers were experienced in vaccinating adults or staff in particular. They were more used to dealing with little kiddies. So they found it quite interesting and quite a change to see the difference there. Illness management. Now, this is the largest activity within the model of care that has and continues to undertake the greatest amount of time, but it's also been the most successful part of this model of care. For it to work as well as it have, I actually had to identify that I needed a team. So the first staff reported respiratory illness case was on the 13th of March. I managed that one by myself, but by the 30th of March, there were 90 staff off sick with respiratory illnesses. Just in those 13 days, it became apparent that a staff health team was needed. The first member that started with me was on the 24th of March. That was Jason. By the 15th of April, I had a team of 5 nurses, including myself, and a full-time administration assistant. The team started to dissolve by the end of May, and the last one finished on the 26th of June, just in time to go off and have a baby. A lot of preparation was required for each of the new team members, as only one had staff health experience, that being Jason. The other staff health nurses in the picture that you can see there came from a range of different fields within mental health. One was a community, 2 of them worked in the inpatient units in acute adult psychiatry. And Jason also works, being the only fella, he settled in quite nicely. As you can see on the slide, there was a range of activities that the team undertook with the staff member who was unwell. The importance there was that they actually had a coordinated and individualised plan of care for each staff member. At the end, when the staff member returned to work, we sent an email with a simple 3-question staff select survey and just asking them about their care that was provided to them. We got amazing feedback on that. In the very early days, there wasn't a lot of information there for our managers to refer to, and they actually were quite floundering So to help them out, I developed a guide, a reference tool that was based on presenting symptoms. And this was staff managers were able to then provide advice around whether the testing and isolation and things like that. So that worked really quite well. Just to give you an idea of how well it has worked, during the autumn and winter months, the staff health team received 801 referrals. Some were for the same staff member. 2 staff tested positive for COVID. Unfortunately, both those staff had been on the Ruby Princess. 1 staff member tested positive for influenza, but that was before the flu vaccine was available. 7 staff tested positive for other influenza-like illnesses. Staff on average were away between 1 and 5 days. What was challenging? Quite a few things were challenging, and the most probably challenging thing was the rapidly changing information. So the advice I'd give a staff member first thing in the morning might be different to what the advice I'd give to a staff member 2 or 3 hours later. And I guess that's just the way it is when you've got a new virus spreading across the world that we don't know anything about. But we managed and we did the best we could, and people were happy. That was the main thing. The other thing is being normally I would work on my own, so I still had my normal work to do. And recruitment, if we've got any other staff health nurses out there, and probably many of you are aware that recruitment, it's not a quick 10-minute thing. It's something that requires a lot of time and preparation. Of course, there was ongoing vaccinations, and there was the odd occupational exposure, being a needle stick injury. So all that was happening, and at the same time, we're still developing up a staff health team and immunisation team, training them and having to develop tools. In reflection, at times it felt like I was juggling balls in the air to ensure everyone had a piece of me when they needed it. Having said that, this has been the best year of my career. I've been able to lead 2 teams at the same time who undertook unfamiliar work with such grace and professionalism. I've had this opportunity to raise the profile of the type of work staff health does and can do to you all today, and perhaps you soon might see a piece in the New South Wales Health COVID update email about what staff health services across the state have been doing to support staff. It has been challenging, but it has also been exciting to be a part of something I could not have predicted when I started in 91. What worked well? The best thing that worked well was the unwavering support from my executive leadership team. I can't speak more highly of them. Anything I asked for, they provided me with. There was no question about it. I said I needed it and I got it. So that was wonderful. Something else that was fabulous was that what was actually interesting is that many staff seem to have the misconception that our staff health service received direct information about COVID or had direct contact with the public health unit. In reality, we received the same information as everybody else in the same way as it was released from New South Wales Health or the LHD. The only thing was I had to interpret it and apply it to the workplace and the workforce. Teamwork. Everyone knows me. Everyone who does know me knows I'm really organised and able to judge many things at once, but the pandemic tested my limits and I needed help fast. I was extremely fortunate in receiving the people for my staff health team. They came from different parts of the service, but they gelled, and once they found their feet worked together so well, I often referred to them as a dream team. Equally, the immunisation team proved to be one of the best decisions. They achieved more in the shortest amount of time that I could have. The manager's guide, they loved it and they still use it today, even with some modifications. As you've been listening to me, you read there that that's just a very small sample of the feedback that we have received in writing from our staff around the service. We have got many more emails and received lots and lots of phone calls, and this was really good for the staff health team because they were new to the service, that the role they needed to, it really boosted their confidence. What can we do for the future? Now, these are not criticisms, these are just suggestions for consideration based on my experience, and perhaps some of the other speakers may have said similar things today. It would be great if the information was fed directly from the government to the LHD before the community via the media. Sometimes I found out about things that were happening in the local community because a staff member rang me up to ask me about them, but I didn't know. They knew because they heard it on the radio. Continuing to have a surge approach for vaccination for influenza each year would be fabulous. At a LHD level, recognising that staff health services can be a one-stop shop for all staff to be assessed, screened and supported. Setting up a communication pathway between public health and population health and staff health for the latest updates. within my service, even though they were fantastic in supporting what I needed, it would be great if we could continue to have mandatory staff illness reporting and monitoring to give me a short-term assistance over autumn and winter months to help with vaccination and to continue to have an influenza team. Just like to, noting that I'm a minute over, I'd just like to acknowledge that the staff health team, Jason Ross, Ashley Wilson, Sally Butcher, Elizabeth Unicum, who had a baby girl, Elizabeth Poole, who was our admin, and Chloe Brady. I'd also like to acknowledge our general manager, who was acting general manager, who had only been in the role for a week, so it actually didn't really understand mental health services, and our director of nursing, David McLeod. I hope I've inspired some of you to seek out your local staff health nurse and say hi. We are a unique bunch of people. We're a small group across the state, but we love our job and we love being there for you all. I'd just like to finish with one last thing, and that is to provide a quote from Richard Branson. Clients do not come first, employees come first. If you take care of your employees, they will take care of you all. Thank you for your time today.
Thank you so much, Belinda. That was fantastic, a really comprehensive presentation and really valuable information in a service that we all have, but often, as you said, isn't carrying a very high profile. It's a very important one right at this time. So thank you very much. Unfortunately, we don't have time for any Slido questions, so I'll thank you and say goodbye, Belinda.
Thank you, Claire.
Thank you. I'd now like to introduce our fourth presentation for the day, Leslie Innes and Rose Maruntu from Sydney Local Health District, who are going to talk to us this morning about sending in the tiger teams, taking care of our staff. Leslie and Rose both work at the Centre for Education and Workforce Development, or CEWD as it's known, which is the education service for Sydney Local Health District. Leslie is the Director and Rose is the Manager of Operations. And from late February 2020, Leslie and Rose have been responsible for the development and implementation of the tiger teams across Sydney Local Health District. Thank you, Leslie.
Thank
Rose.
You. So thank you for the opportunity to share our tiger team journey today. Rose and I are here representing the dedicated members of our tiger team. And I'd also like to acknowledge the contributions of the other services that we've actually worked with, and it's only through the collaboration with them that the work of the tiger team has really been possible. Our journey started back in February 2020, which seems like a very long time ago now. When the COVID pandemic started, restrictions meant that the Centre for Education and Workforce Development was unable to deliver the normal education services that they had been. Our Chief Executive, Dr. Teresa Anderson, asked us to come up with a model for supporting our workforce at this time. Keeping our staff safe and well informed about policies and procedures and changes in relation to COVID-19 was critical for the safety not just of our workforce but of the community. We needed to ensure that all staff during the pandemic had the skills required to undertake their role, were well supported, but most importantly felt safe in the work that they were doing. Our tiger teams were actually launched in late February 2020 and they've been in operation ever since. The slide that you can see just now is the model of our original model of our tiger team, which shows 5 different teams, each focusing on a different aspect of staff education and staff safety. The model's evolved a lot since February, but the same principles and approaches remain the same. And as you can see, we had 2 primary key messages, and that was looking after ourselves, each other, our patients, and see something, say something. So these key messages were embedded into the education that we delivered and in all the communications that we actually did across the district.
All right, staffing was obviously critical as we were providing services across our entire district. The staff from the Centre for Education and Workforce Development were immediately redeployed, and shortly after we commenced, we were joined by a number of fabulous staff from the Sydney Dental Hospital. Over the time, many of them have returned back to their substantive positions. We still have a number who are working with us today. They brought an amazing skill set that really complemented the skill set of our existing team. We've been really fortunate that over the last 7 months, our team has been staffed by expert educators and clinicians. I really think that the level of expertise that each team member brings has made a significant difference to how much we can achieve as a team. One of the first things that we did was to develop a suite of education interventions to help staff become more prepared to manage patients in COVID-19. These education interventions included a 2 to 3 minute education piece with posters that could be used at the end of meetings, a 15-minute education piece that could be delivered as a huddle or an in-service education. We developed a folder with all the education resources that was left on every ward and in our clinical services, so that the ward-based educators and senior clinical staff could lead with COVID-19 education. The folders also had a section for memos and communication, which were updated on a regular basis by the members of the Tiger team. Every day, a member of our Tiger team would visit the ward to support staff with education, assist with problem solving, and to check on staff well-being and welfare. A Tiger team hotline was established, which was manned 7 days a week. Our team was also responsible for ensuring that all of our staff were safe with donning and doffing of PPE through education, observation, and competency assessment. Although we worked with all staff, we had a particular focus on the high-risk areas. In the early stages, we had a team member based in the COVID-19 testing clinics, observing and assessing staff with their donning and doffing of PPE. Over the months, we had lots of opportunities to strengthen relationships with staff across the district and to reconnect on a regular basis. We delivered education and safety posters throughout the organisation, ensuring that there was consistency in the information being displayed for staff and members of our community. Our district was very fortunate to receive lots of very generous donations from local businesses and large companies, which brought a lot of fun to the workplace. The Tiger team took responsibility for delivering some of the donations across the district, including 2 tons of Easter eggs and Kit Kats. We also launched a Safe Staff Tips to ensure that staff did not take COVID-19 home with them. This included staff care bags, which included machine washable carry bags to and from work, along with a Ziploc bag for their phone and a zippy to ensure that people weren't wearing lanyards. Thousands of bags were packed and distributed by the Tiger team. Team members also provided respiratory swabbing education across the district, developed a competency to assess staff against, and rolled out respiratory swabbing competencies to drive-through clinics, special health accommodation, and our facilities. At the end of April 2020, our scope changed as we took on the responsibility for the initial mask fit testing program that was rolled out across the district. 28 Tiger teams completed the mask fit testing training program. To date, we have tested over 3,500 staff and have developed expertise in both disposable and reusable masks.
As was mentioned, the scope of the Tiger team has grown as time has progressed, and it still continues to grow, which we think is really a hallmark of the success of the team. We continue to provide frontline support to the health hotels, the COVID-19 testing clinics, and our various pop-up testing clinics. But we've also provided education to community partners, including Aboriginal NGOs that are in our local area. And that education focuses on COVID-19 and basic infection control principles. Our responsibilities have also included facilitation of student nurses in our COVID-19 testing clinics and the pilot of the very first student-led COVID-19 testing clinic in August this year. The feedback from the students that have been placed with us has been overwhelmingly positive, with many of them saying that this was one of the best placements that they've done. And feedback from the staff has also been incredibly positive, as the students have provided a great support to our workforce who have been deployed to our testing clinics. Most recently, we've led the establishment of the COVID Safety Support Team, which is an extension of the Tiger team. People have been employed directly to this team to conduct a series of safety checks in our COVID clinics and health hotels to ensure that our staff and community are safe. There's around 11 tools in total, and each hotel and testing clinic has multiple visits each week to conduct these safety checks. As you can see behind me, the feedback from the organisation has been overwhelmingly positive, and I know that the team have been really grateful for the opportunity to support the organisation in this way and to have such a positive impact on our staff. Being part of the Tiger team hasn't just impacted on our organisation, but it's impacted on the team members as well. We all feel we've had a unique opportunity to be part of something amazing that has really had a positive impact on our workplace. This initiative has also enabled our team to expand our strong and lasting relationships across the organisation. And we do know that the Tiger team will continue post-COVID-19, continuing to look after staff safety in our organisation.
Fantastic. Thank you very much. Huge achievement that you've made in the past 7-8 months now. Yeah. So congratulations. It's quite a schmick system, and certainly mass fit testing that many staff at this point is quite extraordinary. So well done.
Thank you.
Thank you very much for your presentation. I'd now like to, sorry, we don't have time for asking questions. There are questions, but I apologise. I'd like to introduce Phil Minns, the Deputy Secretary for People, Culture and Governance, to give the closing remarks to day 3 of the forum. Phil.
Good morning, folks. And can I thank you for being on the session both today and perhaps for the previous 2. And thank you for the commitment that's taken, your engagement in the process, which has been challenging, I would expect, and most importantly for your passion for thinking about issues to do with our workforce, and then your willingness to try to take new actions that get us better results. I thank you for that passion always and all the time, but most especially in 2020. And I guess it's very encouraging that there are so many of you who have committed to participate this year in the forum. I understand our registrations have been north of 800, so that's tremendous. You're probably a little tired of hearing about silver linings associated with COVID. But you know, when we get the technology to function, we do manage to get excellent opportunities for engagement, as we can see through this process over the last 3 weeks. So it's our hope that we've been able to give you some insights and some calls to action for things that you will try out and learn from your peers and colleagues across New South Wales Health. Now, in my speaking notes for this event, I was asked to give some consideration to my reflections about 2020. And there's a serious risk that in doing this becomes therapy for me and a little disturbing for you. But I have been asked to do it quite a few times in recent weeks and months, so I think I'm getting better at unpacking my sense of the year. And I'll start with something that I've done probably throughout my career. I tend to come up with a notion or an image of the organisation I'm working in and what characterises it, and I try to make it as shorthand as possible. I won't go into the detail, but I did end up after a year deciding that the Defence Organisation was best described as a giant marshmallow. And I won't explain that at this point, but perhaps if you catch me one day you can ask. But my reflection about working in my role in the Ministry of Health a year or so into it was that it was very much like going to work each day and being placed in a front-loading washing machine. The door was then closed and you were subject to whoever had control doing whatever they chose to do with the implement. Now, how did the washing machine go in 2020 and indeed through the back end of 2019 when the bushfire season commenced? About the only way I can persist with the washing machine analogy is to say that it's now pretty clear that the control panel is in the hands of a mad experimental scientist, and you don't actually get to leave the washing machine at the end of the day. You've just spent probably 6 or 7 months in it. Now, so that this doesn't become disheartening, what does that image of how challenging New South Wales Health can be, what does it do for my reflection about what we've had to try and achieve in the last 12 months? And the 5 key notions that I land on are disruption, agility, collaboration, persistence and resilience. So I think the Harvard Business Review and many other outlets were pretty keen on the idea that the digital age was the biggest disruptor that we would experience in our lifetime. I think that's been pushed into the second position now with COVID-19. And the disruption has driven an acute need for an agile response across the whole system. And just hearing the couple of case studies from the system prior to me talking to you now, and the ones that you've featured previously in the Workforce Forum, it's very clear that we've demonstrated that capacity to respond fast in a tremendous way. But the agility won't do much for us if we don't manage to collaborate, if we don't manage to join up the parts of our system, whether it's in a hospital, whether it's in the support services, whether it's across the pillars, whether it's working with the ministry. So managing to collaborate to come together in a single pursuit, absolutely critical in the times that we've faced. And you've had to be pretty persistent through it. Some of the efforts on occasion to make some breakthrough change probably didn't succeed. They needed another go, they needed more work. And at a personal level, you've had to have a fair bit of resilience to be able to cope in what has been an enduring and ongoing challenge associated with all the things that have unfolded. I think a few people with biblical references have said the only thing we've missed out on so far has been the pestilence, but I understand that it could be a big year for locusts coming up. So I think the gratifying thing is that my 5 reflections there are pretty consistent with where you focused the Workforce Forum this year, with the notions about thriving in adversity, adapting to change, and today's theme of tenacity. So I'm glad that there's some concurrence in that thinking. And if I reflect on some of the messages that have been given to you by the keynote speakers, in the panel discussion with Shane Fitzsimmons and Elizabeth Koff, our secretary, there was a focus on authentic and empathetic leadership. Leadership at a time like this is authentic if you find your voice, your personal voice of the message that you want to bring. And I think Elizabeth also emphasised the idea that at a time like this, we really have to focus on our patients and the experience of our patients and their family and carers. And then Dr. Harris, known to you, I think, as Harry, based on what I'm advised, the Thai K rescue champion. Just the ideas about how individuals play their role, but teams make the difference. And a crisis can become a point where clarity about how individuals and roles come together can be acutely tuned, and it can also be quite a challenge. So 2020 has certainly given all of us the opportunity to try and find that clarity about how we work together in the best interests of the system and our patients. So, my thoughts about all of those themes is that it's tremendous that you've played your personal role and that you've contributed to the work of your team to fulfil what we try to do in New South Wales Health. And today you've heard from Dr. Jill Hicks, and her theme was tenacity, and that has a particular resonance for me. My father used to have a remark which was that you needed to have tenacity of spirit in life. One of his most famous usages of this term was when he, in partnership with me, bid 10 no trumps in the game, the card game 500, and managed to do that without possession of the joker. Now, if you've ever played 500, that's a pretty compelling absence. But he had certainly tenacity in spades. So I'm pleased that that message has come through today. And the idea that you've got to be pretty persistent and determined in a time like this is obvious. But beside that is the theme that you have to have some self-care. You have to have some awareness that it is not really the case that it's okay to just trudge on. It is what it is and we just have to go. Well, there's some compelling truth to that, but there's an acute requirement that we also put some effort into self-care and team care so that we manage to get through it and we manage to come out the other side. So it's my profound hope that our hopes are fulfilled in 2021. 2020 ends, doesn't get extended somehow, and that in the new year, or the first or second quarter of the new year, we can look forward to the potential of vaccinations and better treatment options. And while we prepare for that better year, it remains critical that we keep displaying agility, that we bring collaboration so we can get cohesion in our teams. We are resilient, persistent, and we demonstrate that tenacity. So in closing, I'd just say that many of you would have been part of a very unique experience in the last 6 months. We've probably done more work around workforce planning, the surge planning workshops, the scenario workshops, and the detailed risk assessments that have occurred across the whole system. We've probably never done as much of this work in such a concentrated way. We had the gift of time that was denied to many others so that we could do that work. And we have done the planning for a bad case and for a worst case. So that would be one of the things I'd say I want us to keep in a post-COVID world. I'd like us to make sure we keep the focus on workforce and on that very detailed appreciation and understanding of what we need to succeed. So I've got 2 challenges for you. Head back to your workplace and see if you can drive in some actions and ideas that you've picked up through the forum, and stay connected with Richard, Tamara, Ian's teams, and stay connected with this network so that you keep supporting each other to produce great outcomes across our workforce in health. So it's now time to say some thank yous. And I think on the screen you can see that we're calling out the keynote speakers: Shane Fitzsimmons, Richard Harris, Jill Hicks, Michael McQueen, the New South Wales Health Heroes who conducted the breakout sessions. Great thanks to all of them. We also need to thank Elizabeth Koff in opening the session and sponsoring the idea, and the Forum Steering Committee members who helped organise the event, along with our team in the ministry. And the last thing I need to do is thank the MC that you've had across these 3 marvellous days, Claire Harris, standing beside me, and we have for her some flowers. I did wonder if they'd be virtual or real, but they are indeed real. Thank you very much,
Bill. That's lovely.
So the last thing to say is that if you've not been able to see all the content, or you'd still like to catch up again on some more, the material will be online for a month, and there'll also be an opportunity to send feedback through an evaluation process. So we welcome your feedback in that activity. Thanks again.
Thanks, Phil. So just in closing, I wanted to let you know that today we've had in excess of 520 people sign up, register and attend today's forum. So it's been by no means an extraordinary success. So congratulations to you all. And as Phil said, I hope you've taken away a lot of clear and key messages for you and your teams. The resources that are online will be there for up to a month, and they've been curated and can assist further, obviously, in your workforce restoration journey. So I really hope that you've enjoyed this year's forum series. The survey, as Phil said, will be there and will help us build next year's forum. So we look forward to seeing you next time, and thank you for supporting me over these 3 days. It's been a wonderful experience. So we'll see you next year. Thank you.
Hello, I'm Dr. Amit Shetty. Welcome to the Future Health Podcast. This is the podcast about the way we work, the work we do, and how technology will influence the future of work in New South Wales Health and the healthcare industry as a whole.
We can do a test in New South Wales within, the fastest we can do is about 4 days turnaround. We can do a whole genome, sequencing all the genes, and some of these tests are even Medicare rebatable now. So there's been a revolution in terms of the technology, the time to get a diagnosis, and our ability to diagnose patients.
If you keep searching for something on Google, you're going to continually be fed what you've been searching for. It's going to feed your own bias.
This is the idea of screening people, offering them a genetic test before they have a baby in order to test whether both parents are carriers for the same very rare recessive genetic condition.
So clinicians have gone from being very patient-facing to being very computer-facing. They're talking to a patient, they're sort of observing the patient, but they're spending a lot of time entering data into digital systems. And that isn't necessarily the best use of their time. They go to medical school for a very long period of time and go through extensive training to work with patients, to treat patients, not to be data entry robots.